Hello everyone, I just wanted to show you how we check in patients. The patients that have an emergency, this is how they're checking in from now. So basically when the patient arrives, they wait in the parking lot for us, they text us and they let us know that they're here. While they're waiting in the parking lot, we're actually getting the room ready. So when they arrive, as you notice, the doors are open, so we can eliminate on contaminating all the surfaces. So when they walk in, an assistant is usually already waiting for them and they take them to the back. Before they take them to the back, we actually have a non-contact infrared thermometer. We take their temperature to make sure that their temperature is not elevated. If it's elevated of 100 and above, we refer them to either an emergency hospital or an urgent care clinic. We are also using Lysol spray every 20 minutes all around the office just to make sure we get rid of all the aerosols. Continuing also with the cavity wipes, we make sure we're cleaning all the countertops here and also all the furniture and the door handles. Follow with that, we ask every patient when they come in to use this hand sanitizer that Dr. Ayzin made himself. So we make sure that they're using that before they come in. Thank you so much for watching this video. I hope to see you soon.